Mojo mamo pravzaprav takrat, ko sem jaz postala mama in ko bi jo res potrebovala, že pri 46 letih zadela kap. Mojo mamo je po prvi kapi, ko se je zrehabilitirala, zadela še ena kap in potem še tretja kap, in po tretji kapi je bila moja mama praktično 20 let v komi. Je bila to kar huda izkušnja. S tem pravzaprav živim ves ta čas. Visok krvni tlak je znan tihi ubijalec. Merilec krvnega tlaka je bil v naši hiši vedno na mizi. Najbrž zato, ker sem bila na to zelo pozorna, zaradi družinske anamneze. Zelo hitro sem v bistvu tudi začutila, kdaj se mi je začel krvni tlak višati, in sem seveda takoj odšla k zdravniku. Midva sva imela en zelo odkrit pogovor z mojim družinskim zdravnikom. Še danes pomnim te njegove besede. Nisem bila pretežka, zdravo sem se prehranjevala, ampak seveda tisto, česar pa nisem dobro obvladovala, je bil predvsem stres. In takrat mi je rekel, najbolj varno je, da imava midva tvoj krvni tlak pod kontrolo. In seveda jaz sem ga upoštevala in začela jemati zdravila za visok pritisk, preden sem bila stara 46 let. Čez nekaj časa se je pokazalo, da ta zdravila ne zadoščajo, in je potem mi zdravnik napisal druga zdravila. In potem se je čez nekaj let tudi pokazalo, da tudi ta zdravila ne zadoščajo več.
My interests were always very diverse. Already in childhood, I was interested in everything from natural sciences to art history. My father was a medical doctor. My mother's background is in chemistry, so it kind of made sense for me to end up in pharmaceutical industry as it combines both aspects. I joined Krka after finishing my PhD studies almost 18 years ago. I was brought up with the ideal of helping people, and that is why I chose a profession where I can make people's life better. Pharmaceutical research and development can be described as putting active ingredients into treatments. It means that active ingredients are combined and made into tablets, capsules, ointments, solutions in such a way that they enable optimal biological and medical outcomes. Cardiovascular disease are still a major cause of death globally and take around 20 million lives each year. Around 50% of cardiovascular patients in well-developed world does not follow the prescribed treatments. More than 75% of patients need to take more than one medication, 2 or 3, to effectively control their condition. When prescribed multiple pills, there is also a higher risk of simply forgetting medication and then not knowing what to do. Single pill combinations are the medication that combines several active ingredients, several drug substances, into one single capsule or tablet. Krka was neither the first nor is the only producer of single pill combinations. However, we recognized the benefits of single pill combinations very early on, before they gained widespread recognition in medical world, because we have good connections with the healthcare. Single pill combinations offer a huge advantage of tackling multiple physiological mechanisms at the same time without burdening the patient with multiple pills. Single pill combinations are not magic pills for each and every patient. There are cases when people need to take one medicine in the morning and another one in the evening, and in these instances they have to stick to multiple pills.
Ko me je moj družinski zdravnik seznanil s tem, da mi bo predpisal novo vrsto zdravil in da bo to zdaj eno zdravilo. Manj razmišljam o svoji diagnozi, ker imam ta krvni tlak pod kontrolo. V pokoju sem zdaj 5 let, tako da kar en velik del svojega prostega časa preživljamo zunaj. Prav gotovo je zdrav življenjski slog in to, da držiš svoje zdravje sam v naših letih, da je to zelo pomembno. Takrat se lotim nordijske hoje, se pravi hoje z temi palicami. V to obliko gibanja zelo verjamem. Imam zelo velik motiv za to, da zelo zdravo živim.
There is a stereotype about Slovene saying that we are hardworking and disciplined. And this, I think it's true. We have high work ethics, which translates, of course, into responsibility towards our patients.